All right, Dr. Petti, on your last video, you were talking about the real bad effects of having any infection, any disease in your mouth, which makes sense because, as you said clearly, you wouldn't want to run around with an infection in your finger, in your toe, nowhere, because, well, boy, I mean, it can kill you. So why wouldn't an infection in your mouth, which is the gateway to the blood vessel, kill you? So that said, I have read somewhere, and you know, I want you to tell me whether that is way out over the top or not. For instance, there was a Japanese researcher in a Japanese university who said that if a person is infected with the HIV virus, that he will be getting AIDS a lot easier if he has gum disease, simply because the immune system is way low down. And there was a lady in California who had a stillborn baby, again because they found gum disease infection in her placenta. Now, with no doubt, there's only one or two of those cases. I think one, as far as I am aware of, and obviously most of us, thanks God, don't have AIDS, so it doesn't really apply to us. But my point is, we're not really talking to the people who have this happening to them, but if something so severe can happen because of gum disease, wouldn't be the everyday flu, you know, basically your immune system down, all the soldiers in your body which fight immune system, which bring your immune system up and fight it, they're all needed to fight this infection going on, and they don't have any, there's no more soldiers left to fight when something else comes at you, like a flu season or whatever. A little bit like, you know, we're in 2 or 3 wars in this country. I mean, boy, let's hope we don't start another one, because where are the soldiers? I ain't going. So tell me, I mean, how far off is this, you know, so we are saying we don't want to, this is not to scare people. This is, however, you know, also to, I mean, I wouldn't travel without a spare tire with my car. That's stupid. So basically, you know, I just want to make sure that if something so bad can happen, our normal thing must be affected. That's just my opinion. But what's yours? You're the doctor, not me.
Right. Well, I don't think I have to say anything, Helmut. You pretty much summed it up pretty accurately. You're absolutely correct. Stop and think about the body in general, and any extra bricks on the load, okay, is going to suppress the immune system. So if you have infection in the mouth, yes, you do have to call on the reserves of the body to go fight that. And let's say you've got, the flu coming around the corner and you need 100 soldiers to fight the flu, but, you know, you've only got 75 left because some of them are over fighting your gum and bone disease. Are you more prone to get the flu? Absolutely, that's just common sense, okay? And with anything else. And some of the more extreme examples that you went over are people that immune systems have been compromised. So obviously, you want to give your body every advantage, every health advantage to stay nice and healthy in there. So you don't need to be dealing with infection in your mouth on top of every other thing that we have to deal with in life when our bodies are aging or things are coming around and we're trying to naturally battle them off. I really think you summarized it excellently in your opening statements on the video. And is it over the top? It's not over the top. No. We've known this for years, and I can tell you this, in my practice, the healthiest patients that I have overall are the ones with the healthiest gum and bone and the healthiest periodontal situation and the healthiest mouths in general. It's just, that's just the way it is.
So a young 20-year-old or 25, 30-year-old lady who is getting pregnant, thinking about getting pregnant, anyway, everyone else, but so let's assume they're getting pregnant, she wants to have healthy gums because, I mean, there's a big gradient in between having a dead baby and having a very healthy baby, it looks to me, and you want to, you understand, just because the baby isn't dead doesn't mean it couldn't be, I mean, mom should be at her best while she's pregnant, right?
Absolutely. Absolutely. Just like the medical community makes a big deal out of all pregnant women should have the utmost attention on their health. So should go for the mouth also. You know, it just needs to be. You're absolutely right. And once again, not only for pregnant women but everyone. Everyone should be free of gum and bone disease as much as possible because it's just going to improve your health. Hands down, that's it.
Well, it's really quite amazing how far beyond just having basically a good look and maybe not smelling when you open your mouth, oral health seems to be going. It's amazing. And even though, yeah, probably we have been talked about it for a long time, but I think most of us don't pay quite the attention to it we should, based on what you're telling me.
Absolutely. Absolutely. And when you visit the dentist, make sure that he is checking for gum and bone disease. I don't want to say a lot of dentists don't do that, but sometimes they do it and don't really inform the patient. So I think knowledge is a great thing to have. And if the patients know what they should be looking for in a dentist and having them check some different things, and they have it explained to them, well, then they're much more informed and they can make great decisions on their health. And that's what we want, people making good informed decisions on their health.
Yeah, so as bad as a tooth loss is, which it is bad, but you know, you guys do put good implants in it, and you can do that. So the technology advanced very heavy, but it's the disease which you're carrying and spread throughout your body while you're losing your tooth, which seems to be much more devastating than the actual tooth loss.
Oh, exactly. Exactly. If you're losing teeth because of gum and bone disease, then you definitely want to get that handled before you even have teeth replaced and implants. You don't want to put you don't want to invest in things that you know have an undercurrent of disease in there. So yeah, you're exactly right.
Thanks for letting us know, Dr. Petti.
Okay.
Bye-bye.
Bye-bye.